Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
My good friend, Dr. Jerrilyn Cambron, then of the Massage Therapy Foundation. We take apart interesting, pertinent, relevant research articles. And today we are taking one from the journal published by the Massage Therapy Foundation. That's the International Journal of Therapeutic Massage and Bodywork, available at ijtmb.org.
Yay!
Yay! And our article today is called Intradialytic Massage for Leg Cramps Among Hemodialysis Patients, a Pilot Randomized Controlled Trial. And it's by Diane Masnardo. She's the lead author. Diane is a massage therapist who is from Ohio and has done some really interesting work that no one really has done before on looking at the role of massage therapy for people who are diabetic and receiving hemodialysis. And are dealing with leg cramps. So the question she's asking is, will massage during a dialysis treatment have any kind of impact on painful leg cramps, both during the treatment or in the time in between the treatments? Jerrilyn, is it okay if I just do a quick synopsis of the article and then we'll talk about kind of where it fits and everything?
I think that'd be great. Thanks, Ruth.
Sure. So what Diane and her team did was they worked with, I believe it was 3 different dialysis centers, and they identified some patients who were having problems with leg cramps. And the argument being made is that leg cramps associated with dialysis can be so painful and so debilitating that it can actually interfere with people's ability to complete adequately and accurately to complete their treatment. And so that makes for the prognosis of dealing with their conditions. Massage during their dialysis treatment, will it help them decrease the frequency of their cramps? And from there, conceivably an argument could be made that that would allow people to, if the answer is yes, then that would allow people to be able to tolerate their treatment better and have a better outlook. So they had 3 locations where they were taking patients, and they worked with them during the dialysis sessions and compared a control group to the intervention group. And each patient got, I believe, a total of 6 sessions. They were receiving dialysis 3 times a week. And they got 6 sessions of 20 minutes massage versus the treatment as usual group. And the main outcome measures they were looking for really was just about change in frequency of lower leg cramping. So they were not gathering a lot of data about other issues or sleep, or we'll probably talk a little bit about pain. They were looking at frequency of cramping. And dig into the result. A quick snapshot of the results is that the patients who received massage reported substantially fewer leg cramps in between their dialysis sessions compared to the patients who did not receive massage. And there was a reduced amount of cramping among the massage group during the dialysis sessions, but that difference between the 2 groups was not so significant. And their conclusion was that this could be an effective, and conceivably that might lead to better treatment tolerance. So this is quite small, but it's a randomized controlled trial. It's a pilot study, and now Jerrilyn's going to talk to us about where that fits and what to look for when we're reading about studies of this type.
Yeah, so this was a clinical trial, which is kind of it's top of the pyramid when we look at different types of study designs. Randomized clinical trials are considered the strongest single study design that there is. The only study design above that in this, the pyramid, the hierarchy of evidence that we have, it includes meta-analyses or systematic reviews, which are reviews of clinical trials. So these are really strong studies. These are what most other healthcare providers look for. And so I'm just very excited that Diane and her team were able to pull this off. So, you know, she did some of the perfectly awesome things that we would expect to see in clinical trials, such as training the massage therapists, making sure that they understood everything about the dialysis center and patients who have these types of leg cramps, and you know, what was the actual intervention. They practiced the intervention several times, and they got together to make sure that they were consistent about the intervention. They used an outcome measure that is validated and reliable, which we would expect to see in this. I think they pulled some of the questions out of that questionnaire to use in their study. They randomized patients, which means there was a random allocation to treatment. So there was no, I think you'd do best in this or in this group rather than yeah. And so that kind of hopefully decreases bias. With clinical trials, there has to be an IRB, an institutional review board, which is an ethics review board for human subjects research. So they had that, and they had several different inclusion and exclusion criteria as to who could be part of this study, and that is really expected within clinical trials. So they did a lot of really good things in this study, and the cool thing, they did report on adverse effects, and they said that in this study there were no adverse effects related to massage, which sometimes we assume in clinical trials that, well, if nothing's said, then nothing really went wrong, but I'm glad to see it in this because you never know.
Well, especially in something like working with people with very, you know, who are undergoing hemodialysis. These are folks with very complex and somewhat fragile health situations. And I was really pleased, as the pathology filter, I was really pleased to see all of the different ways that they took effort to make sure that what they were doing was going to have the maximum possible benefit and the minimum possible risk.
Mm-hmm. Right. And yeah, because these can be very frail individuals with kidney disease. And so I think making sure that this is a safe treatment is very important for them.
Yep. And so, Jerrilyn, so you've placed us here. We've got a pilot study. Can you talk a little bit about what a pilot study is?
Yeah, so pilot studies are smaller scale studies. They're usually done before a large scale just to make sure that the methods are kind of on point and a good way to do the study. Some pilots are unsuccessful in that they can't recruit enough patients, or the outcome measures aren't very helpful to trying to answer the research questions, or there's other problems. And so small scale pilot studies are good to test out how the large scale studies will be pulled off before they're actually done, to make sure that there's, you know, that we think of everything before they start.
It's a little bit of a sort of proof of concept kind of starter place, right?
Yeah, it's a starter study.
Yeah. So, you know, at this point, this is when, you know, I am willing to jump in and talk a little bit about what this research question is and its importance, although I've sort of have done that. So we have this population of people with advanced kidney disease who find that leg cramps, I was skeptical about this, so I went back and looked at the resources in this paper, you know, to see that leg cramps for people undergoing hemodialysis are considered really a serious problem that can limit people's ability to tolerate treatment. And indeed, it's a substantial problem. I was absolutely convinced. Shortening as little as one dialysis treatment per week is associated with a statistically significant increased mortality risk. This is a big deal. Mm-hmm. And so, you know, that's an important part of the study, is to make a case for why it's an important question. Mm-hmm. And the rate of kidney disease, you know, is of course quite high. Our chances of having clients who live with this kind of condition are very good. And so it's an important question that has not, interestingly, that has not been asked before. So in looking at what other people have done to ask this question, how do we manage leg cramps for dialysis, at least with manual therapies, there was very little to see. There was one, I think, a reflexology study that got sort of generally good results, but there was no control. It wasn't a terrifically rigorous study. And there was something else with compression machinery that also had some interesting, some positive responses. So this was all the background that they had to sort of lay the groundwork for, well, what might massage therapy do in this kind of setting. So Jerrilyn, if you want to walk us through a little bit of the methods and then the results, let's talk about what they found out.
Sure, and I think you covered most of the bases already. They were looking at a change in cramping amount, and so I think they used a question from this questionnaire called the Kidney Disease Quality of Life Short Form. I wasn't 100% sure because what they talked about the survey, but then they talked about how the research assistants interviewed the patients before and after, and so looking at that, they were asking the patients to report on any cramping, I guess, / pain in the previous 2 weeks. So with this study, they were looking at just really the change in pain and how much cramping pain did they have at the beginning of the study and then at the end of the study after the 2 weeks. And that was essentially the whole study. So it was a very short study. They didn't do long-term follow-ups to see if the massage helped them for a long period of time, which is fine in a small study like this. They did find that there were significant changes when they measured the amount of cramping that people had at home, but there was not a statistically significant amount of difference when they were looking at the amount of cramping they had at the dialysis center. That said, when we look at the actual numbers, we can see that there were more cramping. There was more of a decrease in cramping in the group that was the intervention than there was in the control, and so there was a better outcome in the intervention versus the control, but it wasn't statistically significant. And some of
right, and again, that's during the dialysis treatments, but the difference in between the dialysis treatments between the two groups sounds like it was very significant.
The ones at home were significant, and if people have cramping at home, like you were talking about the significance of the study, they can't sleep, they can't work, they can't move, their quality of life is very low. And, if they're at home, they don't have healthcare providers right there that they can talk to and help manage the pain. And so, finding out that there's a significant improvement with these folks when they're at home that's a big deal to these folks.
Mm-hmm. Right. You said something just now that I think is worth talking about a little bit, which is that this is a really over 2 weeks. And rather than have something like a daily journal that might, track how many episodes of cramping they have every day or something like that, really they just did a post-series interview to gather data from patients that way. And, I have a sense that if you were doing this study, you might set that up a little differently.
With every study, it's funny, you do a study and then you think, gee, we can improve this the next time around. And that's really what pilot studies are about. And so in this study, sure, I think that instead of interviewing them at the end, they could have had some sort of a journal or a way to track the amount of pain or cramping that they have on a daily basis or while they're at the dialysis center might be more effective. Using the actual survey, the Kidney Disease Quality of Life short form in its entirety rather than pulling questions out might be beneficial in this study or in future studies. I was curious as to how patients were chosen for this study. It talks about how the study coordinators were doing chart abstraction, so they were actually going through charts at the dialysis centers and figuring out who might be a good patient for this study, but I wasn't clear if they were consecutive patients or if they were kind of just hand picking, which might lead to some sort of a selection bias in terms of who's in the study. So, of course, there's there's always something that can be improved in a study, even large-scale studies. I think that, again, there were so many good things about this study that it's very beneficial to have this in the literature and to build on this in the future. One of the things that Diane Masnardo and her team talk about is that further large-scale studies are needed, and that really looking at just the 6 massages, was that enough? Should there be more? Should it be for a longer term? Is the dosage appropriate? What happens, with withdrawing the care? Does the cramping then go back up? And so there's still a lot of questions to be answered, but I think that this is a wonderful start.
Yeah, and I want to really encourage our listeners and the readers of the journal to remember that there's a lot of benefit to a study like this that just hones in on one single question.
Mm-hmm.
There are so many other things we could have asked, right? About pain, about sleep, about baselines and long-term follow-ups and all of that. It's wonderful, it's great, but sometimes it's good to have a study, especially with a new researcher like Diane Masnardo, who's not a professional researcher, hasn't been. There's benefit and strength in saying, okay, I need to put that stuff away and just hone in on this one thing, which is about frequency of cramping. I really, as a reader of research and who is not a professional researcher, I really appreciate it when some of that extraneous information is left out for me, because I just want to focus on the single. That said, it raises all of these exciting other questions, and I hope that because her results were so clear that that this might stimulate some people who are interested in improving the quality of life for people living with kidney disease, to look more closely at what manual therapy might do. And when we think about how our listeners might apply this, I don't know how many people listening to this are volunteers or employees at dialysis centers who are working with people while they are undergoing dialysis. And my sense is probably not the massage therapists are working in situations like that. But what this study does tell us is that there are safe ways to work with people who are undergoing muscle crampings related to hemodialysis. This is a study where you can look at some of their exclusion criteria about weight loss fluctuations and ulcers and whatnot, about that gives some guidelines about safety and application, but also to realize that there are benefits that we can bring to this population. I'm a pathology teacher, and I tell people that advanced kidney disease contraindicates a lot of massage for all these reasons. But here's a reason. Here is a way, and here is a circumstance in which advanced kidney disease might really, really call for careful massage. And so I love to have my boundaries tested like that with some data, behind it, because that's an important thing for us to remember. If we just, color only strictly within the lines, that's a pretty boring picture. So I want to really applaud Diane Masnardo and her team for asking this brave question, and I'm really excited to see if we can get some more people to pick this up and ask more follow-up questions about it.
And I think, if any of you are in a small group or in a teaching type situation, what Ruth just said are 2 different questions that really you can consider. And the first being looking at the exclusion criteria. Are they true contraindications, or are the criteria that Diane and her team used just based on trying to make some conformity to the type of patients that they have? And so look through those criteria. And the second question is looking at, what kind of training do you think you would want as a massage therapist if you were asked to start working in a dialysis center?
Nice.
You want more training on how, what types of contraindications should you be looking for, or how should you treat them, or how does the center work, or, what types of training do you think that you should have or would you want to have before working in this type of center?
Perfect. So with those discussion questions, we'd love to hear your feedback. Leave us reviews on the podcast. send us a note, tell us what you're curious about, and we'll let that feed into future research purchase. Jerrilyn, I believe our time is up.
Yep, I think it is. So for more information, please visit us at massagetherapyfoundation.org, and we'll keep having these research purchase. Let us know what you think.
Thanks, everybody.
Thank you.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.